The first video in this series took a quick look at the different educational levels and career options available to graduates in the field of psychology. As you can see, there are many types of master's degrees that can prepare you to become a counselor or a therapist. A terminal master's degree is when a student earns a master's degree with no intent of going on for a doctoral degree. This is a great option because a lot of these programs accept more students, so they're easier to get into compared to a doctoral program. They are also shorter, typically requiring only 2 years of education and training. Terminal master's degrees focus primarily on training you how to administer therapy rather than on doing research or teaching. In general, master's level therapists make approximately $40,000 to $65,000 per year. The actual salary may vary based on the type of master's degree earned, what part of the country you live in, and what specific work setting you're in. For most master's degrees, you can work in private practice after you become licensed. Some typical programs you'll come across at a lot of universities are a Master's of Social Work, a Master's in Marriage and Family Therapy, a Master's of Education in School Counseling, and a Master's in Science or Art with a focus on mental health counseling or general psychology. If you've decided that the master's path is the way you want to go, there are some important things to consider. Make sure the program would be preparing you for a career in counseling or therapy. Some master's degrees in general psychology or clinical psychology do not prepare you for a career in counseling. These are intended for students desiring more research experience and advanced psychology courses to prepare for applying to a doctoral program. It's always best to look for accredited programs. Different organizations accredit reputable schools that meet specific standards for education and training. Getting your master's degree from an accredited school will have critical benefits in the future when it comes to getting an internship, a license, and a good job. For example, in the U.S., the Council on Social Work Education is the only organization that provides accreditation for all MSW programs. Lastly, make sure that the programs you're considering will train you in evidence-based practice. There are over 500 different therapy approaches available to help alleviate mental illness. Some of these approaches have been rigorously studied with good scientific research, while others have not. If you're trained to give therapy that's been tested in randomized clinical trials, it's more likely that you'll be able to help your future clients. Likewise, you should be skeptical of programs offering training in types of therapy lacking consistent scientific evidence. Next, let me give you a brief overview of the different types of master's programs. First, the Master's in Social Work is a very versatile degree. When you get your MSW, you can get involved in advocacy or policy settings. You can become a licensed clinical social worker and provide therapy in a variety of different settings, including hospitals and private practice. There are a lot of different types of social workers, such as social case workers, medical social workers, school social workers, and clinical social workers. There are also social workers who work with administration and management, community organizations, and social policy and research. In terms of the time investment, a master's in social work is a pretty quick way to enter the workforce, taking 2 years of education plus a 1 to 2 year internship. A Master's of Art or a Master's of Science in Mental Health Counseling is a 2 to 3 year education that prepares you to be a licensed professional counselor or a licensed mental health counselor. There's not much difference in these titles, but it's helpful to look at the individual school to see what courses you would take, what kind of practicum or internships you'd complete, and what kind of supervision or mentoring you'd receive. These differ from program to program. Some programs offer more focused training, such as in addiction, career counseling, marriage or couples therapy, school counseling, college counseling, or working with specific age groups. Completing this master's degree typically takes 2 to 3 years. After school, you would complete an internship and take state licensing tests before officially becoming a licensed counselor. A master's in marriage and family therapy is a great option if you want to work with families, couples, children, and adolescents. Most of these programs are based on the family systems theory, which considers the couple or family as a unit that should be treated conjointly. These professionals work in private clinics, domestic abuse shelters, substance abuse clinics, schools, adoption agencies, and hospitals. Much like the other master's programs, the school portion of a master's in marriage and family therapy takes about 2 years to complete. After graduation, you'll have another 1 to 2 years of supervised work and state tests to become a licensed marriage and family therapist. The next option for a master's degree is in education with an emphasis on school counseling. Sometimes these professionals are called guidance counselors or school counselors. With this master's degree, you could work in school settings with the goal of helping children succeed academically and emotionally. You might do individual consultation with children and families or work with children with special needs. A major responsibility for school counselors is to conduct assessments of a child's academic and social emotional functioning, and to regularly attend planning meetings to ensure that the child succeeds. If a crisis occurs in the school, such as a traumatic event or death, school counselors can help children and staff cope with those events. There is one last type of master's degree that is significantly different from the other options, which is a master's in psychiatric nursing. Psychiatric nurse practitioners are advanced practice registered nurses who have completed their master's or doctoral degree in nursing. Both of these graduate programs require having a bachelor's degree in nursing, and it is intended for individuals who want to work in the medical field with a focus on treating mental health issues. Psychiatric nurse practitioners are in high demand. They can prescribe medication, and they make approximately $110,000 to $120,000 per year. It's a job similar to what psychiatrists do, but without going to medical school.